Another Liberal to this group of being hypocritical. The Liberals are adding so much to our debt that in the future, all of our revenues, all the wealth generated by our workers will go to lenders, bankers, and the wealthy. There won't be any funding left over for other priorities, including healthcare. This is one of the reasons why we're proposing to protect our finances. We want a plan to gradually bring down deficits without major cuts like what the Liberals did in the 90s. Such a plan will take discipline and early planning starting now, and it's necessary for the benefit of our social programs and taxpayers.
Member for Courtenay-Alberni.
Thank you, Madam Speaker, and I want to thank my colleague for his speech. And I'm glad to see the Conservatives finally supporting a significant increase in the transfer of health share of costs to the provinces' investments. Madam Speaker, one thing that really concerned me was when he talked about CERB being the cause of opioid deaths in our country, when in fact we've heard from public health officials, including medical health officers on Vancouver Island, the mayor of Vancouver, calling on the government to first name that it's a national public health emergency under the Emergencies Act, the opioid overdose and fentanyl poisoning that's taking place, to decriminalize personal possession, and to create a system to provide safe, unadulterated access of substances to people who suffer from opioid addiction. And Madam Speaker, yes, we agree with treatment, but does he support those medical health officers and Moms Stop the Harm and all the medical professionals that are asking for a real plan and action?
A very brief answer from the honourable member for Carleton.
Well, of course, the member says is absolutely false. The CERB was necessary. We supported it from the very beginning. What I do say, though, at the same time, is while people need income while the governments have shut them out of jobs, we need to make it our urgent priority to make it safe again for them to get back to work, because work is part of a healthy life. In the meantime, of course, they will need income supports from the government. As for the rest of the members' questions, we support recovery. We believe in recovery from addiction, and we believe that should be the urgent priority of governments to bring about the recovery of the people who are suffering from these addictions so that they can rebuild their lives and go on to a brighter future. Thank you.